Hi, I'm Dr. Daniel Myercourt from Perth Orthopaedics and Sports Medicine. Today we're going to be talking about a very interesting question. Are you going to like your knee replacement? Now obviously every patient wants to like their knee replacement and every surgeon wants to do knee replacements that patients like. We all know someone who's had a knee replacement where they've got ongoing pain or stiffness or they don't like their knee replacement. What are the chances of this happening to you? Will you like your knee replacement or are you at risk of not liking your knee replacement? So we know that in Australia, we track the outcomes of all knee replacements that we do, and that is through the Australian National Joint Registry. The Joint Registry is now presenting us data to deal with satisfaction or how happy patients are after knee replacement surgery. The good news is that 93% of patients that have undergone knee replacement in Australia are satisfied or are happy with the results of that surgery. If we break it down a little further, 80% are really happy. The next 13% are fairly or moderately happy. There's 7% that have some degree of dissatisfaction after their knee replacement. Of that 7%, 4 or 5% has mild dissatisfaction, where the patient is not as good as we would hope they were, but they're still better compared to how they were before surgery. And around 2% of patients have severe dissatisfaction or regret having done their surgery. Ways to reduce the chance of you being dissatisfied are to see a physiotherapist and start prehabilitation first. Avoid knee replacement if you've got mild to moderate disease. We know that if you can walk an hour and you've got a relatively normal x-ray and you've got mild arthritis on your MRI scan, the rate of you being unhappy with your knee replacement is significantly higher, and I strongly counsel all of my patients who are in this category to avoid knee replacement surgery. If you've got pain in multiple body areas, you may again be dissatisfied with your knee replacement as it may not solve issues in other parts of your body, or you may be at a higher chance of having ongoing pain after your knee replacement. Taking a big picture approach to surgery is important. Again, we know that patients that are happy, they take a big picture approach. They understand that their knee is going to be a little sore and stiff and swollen, and this is going to last for up to a few months after surgery. But they understand the big picture in that they're going to be more functional, things are going to get better. In some ways, they're taking a glass half full approach. Patients that dwell on every aspect of their knee, on the pain around their knee, the swelling around their knee, or the lack of normal feeling within the knee, are essentially taking a more glass half empty approach, and we do know that they are at higher risk of dissatisfaction. Now, obviously, as surgeons, there are many surgical techniques that we employ to optimize the balance, function, movement, and stability of your knee. But even with all of these modern techniques, we cannot eliminate this chance of dissatisfaction. So, all in all, if you have got moderate to severe pain, limited function, if your world is shrinking, and you've got significant arthritis on your x-ray, you are likely to be happy after your knee replacement and likely to function well. If your pain is mild or moderate, or you have a relatively normal x-ray, then certainly persisting with physiotherapy, simple analgesics, optimizing your weight, and avoiding knee replacement for as long as physically possible would be a preferable approach.